rolling. Okay. Alright, so we talked about the vertebral column and that there are 7 cervical vertebrae. You can remember that because you eat breakfast at 7 o'clock in the morning. There is 12 thoracic vertebrae. You eat lunch at 12 o'clock noon. And there's 5 lumbar vertebrae, and you eat dinner at 5 o'clock. There is 5 fused vertebrae down here at the bottom called the sacrum, and the tailbone at the very, very bottom is called the coccyx. C1 and C2 have very special names because their shape is slightly different. So C1, the very first one, is Atlas, because Atlas was the guy who pulled up the world, your head is the world. C2 is Axis, because your head rotates on an axis. Each vertebrae has a bony protrusion that sticks out posteriorly called the spinous process. The ones on either side are called the transverse process. Then you have a cushion in between each vertebral body called the intervertebral disc. Inter meaning between, vertebral, and then disc because they're in a disc-like shape. They help cushion. If I could look inside one of these vertebrae, there's a hole in it. That is called the vertebral foramen or vertebral canal. And it's inside the vertebral foramen or canal that houses the spinal cord. We talked about that you have 2 scapulas, 2 shoulder blades called scapulas. You have a medial border or a vertebral border, an axillary border or a lateral border, spine of the scapula, and the acromion, which is at the very tip right here. You have the supraspinous fossa at the top of the spine. You have the infraspinous fossa, which is an indention below the spine of the scapula. On the anterior side, you have 2 coracoid processes right here. And on the anterior side, up underneath here, is the subscapular fossa. From a lateral view, you have the glenoid cavity or the glenoid fossa right here. And the shoulder joint itself is called the glenohumeral joint because it's where the humerus and the glenoid fossa meet up. Stop for just a second.